we're on here. Okay.
Good. So when we look at treating the scapula, our considerations are going to be testing in the x-axis for the upper portion here in the body of the scapula, y-axis through the medial border, and then the diagonal axis through the lateral border. Once we determine which one we're going to be treating first, we will go ahead and apply our containment. Our scanner is placed somewhat over the area. It can be laid there or just held with a finger or two. Our x-axis we're going to be containing from the shoulder girdle, and the other contact will be here on the medial border from the spine of the scapula down. Engage that with the heel of the hand like so. And position yourself, make sure the patient is positioned posteriorly close to you so you're not straining, and that your body position is balanced so that you are not straining your back. Make sure your head is upright and your breathing is comfortable. Okay? Remember, you need to maintain the containment sufficiently, and you need to have your focus directed towards the change in the tissue rather than the strain in your own body. The medial border is also treated from this area here. Your upper contact is here on the superior border of the spine of the scapula. The containment is relatively inferior and anterior. The inferior border, you may need to get the person to move their arms slightly to mobilize it in order to locate it. Then place the inferior angle in the hypothenar side of the hand in like so, and then add your containment this way. Your containment for this one is superior and inferior to reduce the expansion in this angle. And then the lateral border can also be tested this way, like so. And you're going to also use the lateral aspect of the humeral head and the acromion, if you can engage both, and coming up from the inferior angle, but this time you're going to be directed up to a lateral superior direction from below, okay, containing this vector. Now we're going to test the upper portions here. There may be an expansion here in the superior angle, and between the superior angle and the spine of the scapula. This area represents the supraspinatus fossa, and so testing in this direction, you can use the trapezius as your indicator, and then you want to contain right on the superior medial border, and then on the posterior aspect here, and the containment is going to be somewhat in the z-axis from front to back like so. Your scanner can be placed in a relative area like that to contain like so. Okay? And then up here, we're going to be looking down towards the shoulder, looking at the size and shape of the acromion, which we will have assessed through our structural assessment, and that containment will be going from front to back like that, get on the posterior and anterior aspects, containing it towards the center. In those cases, as I mentioned in previous videos, you will have treated the long axis of the humerus to some extent. You may find that you also need to treat the humeral head a little more specifically before you're able to treat the acromion, but at some point this is going to be accessible. Another feature here in the upper part of the humerus is in the glenoid process. And in order to contact that, we need to locate the coracoid process anteriorly, and the back of the glenoid process just medial to the scapula, to the humerus rather. And we're going to test that vector in a couple of different directions, and our containment is going to be on the posterior aspect of the glenoid process and directly on the anterior portion of the coracoid process. And so we're going to come in with our hypothenar or thenar eminence right on the anterior aspect of the coracoid process. And that angle may vary slightly around that area as well. Containment is towards the center of the glenoid process. Now, another consideration with the shoulder girdle is the clavicle. If you've determined the clavicle is primary on one side, you're going to be testing it in the long axis, like so. You may also find there's some localized expansion in certain areas, especially when there's been maybe a green stick fracture or some more significant injury directly to it. In that case, you can position yourself just above the patient. You want to contain on the medial border with the hypothenar eminence, which is just at the lateral superior aspect of the manubrium. Okay, you can position the scanner in the area. Your lateral contact, locate the acromion process and just look for that small lip. That's pretty much all you can find here, coming in through here. Let's redo this, I did it wrong. Okay, let me just check something here. I do teach it this way too, but it's not ideal. So for the clavicle, we're going to check the long axis, and we're going to be testing it in the long axis. We may also locate a local expansion of the transverse areas through here, depending on the injury. In order to treat it, we're going to locate the medial border, and our position is going to be having the patient close to us. We're going to position ourselves close to the area. The medial border can be contained with the hypothenar area contact here. The scanner can be placed in the area, like so, above or below. And then we're going to also locate the lateral border by finding the acromion process, looking for that small elevation just on the medial side of that, and engaging that with the thenar eminence of the other hand. You're going to also use the acromion to contain that. And then, so the lateral contact is going medial and somewhat posterior in that vector. Your medial contact is going to be coming in through the medial epiphysis and then wrapping the heel of the hand around the front of the clavicle, like so, so that you're containing both laterally and slightly posteriorly to contain this expansion, forward expansion of this normal curvature of the clavicle. All right, so if you notice, the position of the hands here is forming a little bit of a V-shaped containment, so you're able to contain all of those components at the same time.